Hi, I'm Ross Hoffman, and I was diagnosed with DISH about 3 years ago. So, why make this video when there are so many other good DISH videos out there? Well, I hate to admit it, but the main reason I made it was I'm trying to find something to do other than watch arrest videos of drunken people. It's quite addictive, and it's not good for you. And I thought I'd try to do something that's kind of semi-useful. But there are other reasons I made the video too. Um, I'm going to tell my personal story, and I think any kind of disease where you hear the personal story of someone else, you don't feel so alone, and it helps you figure out what they did and what you can do. So I'm also going to provide structural information about DISH. And I was a mechanical engineer in the aerospace and medical industry for 40 years. And one of my specialties was structural engineering. So I kind of look at DISH from a different perspective, more as a body structures problem than anything else. And I'll try to give you that special insight in that area. I'm also going to provide general sort of anatomy information that will help you in reading the literature. This is such a poorly understood disease that if you really want to try to figure out what's going on, you got to read for yourself. You got to study for yourself. And you're going to run into all the medical terminology and anatomy issues that come up when you're trying to figure out what they're saying. So I'll cover some of that. And finally, I'll give you some information on how to deal with the medical establishment, what I've learned in doing that, and my mistakes that I've made that I think you can learn from and do a more efficient job in getting care for DISH. Okay, a couple disclaimers. Number one, there are some people who only are interested in 2 or 3 minute long videos. They're always kind of yelling, get to the point, get to the point. I ran into this on another channel, YouTube channel that I had. This is not going to be that way. I'm providing information that I learned. There's a lot of it. This video is going to be probably over 20 minutes at least. And so if you're one of those get to the point people, tune away right now. Leave. Go do something else. You're not going to be happy. Second disclaimer. I am not a doctor or a medical person in any sense of the word. I was a mechanical engineer that dealt with structures for 40 years. I worked in the aerospace and medical industry. But if you see anything that I say and maybe want to take some action on it, or you're going to make a decision based on it, check with a medical professional. First, the problem with that is medical professionals, this disease is poorly understood. There's not many people who really understand it, and even those who deal with it a lot, the theory is not understood. They don't understand what causes it. They don't have any good cures for it. So even if you talk to medical professionals, you're going to have a hard time finding the right person to talk to. I think you'll find the story of my diagnosis interesting and helpful in pursuing information on your behalf. about 5 years ago, I started having lower right hand back pain. It was kind of a constant dull pain. No known cause that I could figure out. And along with that, I have rib pain. I had rib, and I still do have it. Mild and severe. Depends on the day of the week. And so I wanted to try to do something about those, maybe find out what's causing it, how I can fix it, and get back to living normal life. The rib pain is so bad that if I do exercise like a push-up or something, my ribs will hurt for 2 or 3 days afterwards. And the intense rib pain that I get is like a heart attack almost. So I started going to the medical establishment to try to figure out what's going on. And I went to a general practitioner. They took x-rays. They weren't quite sure what it was. I went to a back specialist for the back issues, and I thought maybe they could help with the ribs too. They added a CT scan, but again, they weren't quite sure what the issue was, what the problem was. So I wanted to make sure there wasn't a heart problem, so I went to the heart people and had stress tests done and heart scans and all that stuff. My heart was healthy, no problem there. So I kind of gave up for a while and said, okay, well, I can live with this. I'll do what I can. But the rib pain got so severe that in desperation, I went to the chiropractors and tried to get some chiropractic treatment to maybe reduce the pain that I was having. And during chiropractic treatment, which helped a little bit, they noticed on the x-ray that there was a solid white bony protrusion down the front of my spine, which is characteristic of either ankylosing spondylitis or DISH. And the chiropractor said I should see a specialist and check this out. Well, I ignored him for a while because, like I say, I'm very cynical about medical issues, especially some kind of back pain or joint pain. Medical isn't very good at figuring out exactly what the issue is there and then fixing it. So the chest pain was still pretty bad. I finally, again in desperation, went to one of the specialties that the chiropractor recommended, and that's a rheumatologist. Now, the rheumatologist seems to be the guy you go to when everybody else has said, I don't know what it is. And the rheumatologist kind of accepted that. It's kind of a compliment. But I went to the rheumatologist. He looked at the x-rays, the CT scans. I think I had an MRI. I can't remember. And he said, well, he definitely sees something there. And he thinks it's either DISH or the AS disease, the ankylosing spondylitis disease, which is very similar. So he ran a few more tests. One was a marker in the blood, I think. And if you don't have it, then you probably have DISH. And he looked at some x-rays in different parts of the chest area. And his final judgment was he thought I had DISH, not AS, but DISH. And so that was about 3 years ago. I finally got a diagnosis from somebody. I did ask whether the orthopedic specialist should have detected that on the x-rays that he took. And the rheumatologist said, probably. So it's a long path to diagnosis. You're going to have to fight for it. You're going to have to push. But you can get it done. My specialty or specialist was a rheumatologist. Maybe an orthopedist can do it, but the guy I went to did not do it. So what exactly are my symptoms today? I still have the chest pain. Haven't been able to do anything about that. I sort of have the lower back pain still, but I don't even notice that because I have so many other problems. I'm 74 years old, and the problem with saying that DISH causes any specific symptom is that at my age, I've got issues like arthritis, bone spurs, maybe costochondritis, all sorts of things that could cause many of the symptoms I have. So it's very difficult to differentiate whether DISH is causing the symptom that you're trying to track down. That's a lesson I learned, and I still am not sure that DISH is causing, for instance, my chest pain. That could be the costochondritis issue. So my actual symptoms are that I have a very stiff spinal region. For example, it's very hard for me to bend over and pick something up off the floor. It's like I get stuck and I got to push through to the final pickup, and it's painful. It manifests itself most easily in trying to put socks on. I always thought I was in pretty good shape and that I wouldn't have any trouble with socks, but I have a very difficult time putting socks on, and it's painful to do so. Also, my neck rotates about 15 degrees before it stiffens up and starts to hurt, and that causes all sorts of problems when trying to back my car up. Try to look behind me for any reason. So there's my personal story. Let's get into some material talking about the structures and anatomy and definition of DISH. And hopefully I'll show you something interesting. All right, this is a presentation from a mechanical engineer's view for comments on DISH. I'm Ross Hoffman. I thought it would be useful to look at the word itself and all the different letters that comprise it. Each one tells a little bit about the disease and helps you understand it. So the first one is diffuse. So it's spread out, not confined to a single location. In a lot of cases, it could be anywhere on the spine, usually mainly in the thoracic or the mid-back region. It can get out to joints. That's not nearly as frequent as being on the spine, but it's not confined to just one exact location. It could be almost anywhere, usually though in the spine. I for idiopathic, cause that is not known. This is the problem. They don't know the cause, they don't know how to prevent it, they don't know how to cure it. This is what causes a lot of our problems. S for skeletal has to do with the skeleton and also the ligaments and tissue around the skeleton. But it messes with the bones and ligaments, and that's what causes the problems. And finally, the H for hyperostosis, too much growth of bone where bone shouldn't be, such as between the vertebrae of the spine, where you need flexible discs in between those vertebrae, and instead you get bone growth, and it causes stiffness, pain, and general discomfort. So this is where the problem is, too much bone growth. I thought it would be useful to talk about directions in the body, and a lot of this you may be thinking is extra information that you really don't need. Well, if you're going to read the literature, and you should, because I don't know if medical is going to help you that much. Very poorly understood disease. You need to try to understand it for yourself. So in this diagram, you can see One of the most important for dish is posterior and anterior. So if this blue plane cuts a person down the middle vertically, then anterior is generally toward the front and posterior is generally toward the back. And you'll see the anterior word when we look at the ligaments on the spine that cause problems here. Sometimes you'll see the literature referring to lateral, which is out to the side. Again, it's a midplane of the body. Lateral goes away from the midline. Medial goes toward the midline of the body. And then for a plane that cuts you vertically, if you go toward the top of the body, you're going in the superior direction, and the bottom of the body is the inferior direction. Before you can understand what's going on with my spine, I think you need to understand some of the general geometry of the spine, and it'll help you understand what dish is doing to the spine. So this is a picture of the complete spine from neck to waist area. And the regions that concern us that dish affects are the cervical in the neck, thoracic, kind of mid-back, and the lumbar, the lower back region. This is where dish causes all the problems, and you'll see this again and again during this talk, but my problems and a lot of dish problems are caused in the anterior or frontal part of the spine. This section right here. So to understand the spine better and what the problem is when dish forms, here's a close-up of 4 vertebrae, bony vertebrae. These are the vertebrae, and 4 discs. These are flexible disc-like tissue that bend. And so when you're bending the spine, you're not bending your vertebrae, they're bones, they're solid bones. It's the discs that are bending and allowing you to bend forward, bend back, twist and turn. And again, this is frontal part of the spine. This is where the problem occurs, and I'll show you that in the next picture. So here is the typical dish final effect. It's the bone growth, and here's the spine, discs, vertebrae. This is the back of the spine. This is the front of the spine. Dish grows bony calcified material on the front of the spine all the way down large sections of the spine. And some people say it looks like flowing candle wax. And it's harmful because it restricts your motion and your flexibility. So this is a side view of that bony growth. And if you're looking in this direction on the spine, this is what it looks like. And I don't know, it kind of looks like flowing candle wax. I'm not sure that's a great analogy. So to show you in more detail exactly what happens, this is the spine again, this is the back of the spine, this is the front of the spine, vertebrae, discs. Here's the real problem for me and for a lot of people. This ligament, this is a flexible, tough tissue that holds the spine together. It runs all the way down the spine in a continuous manner, but because it's flexible, when the spine bends, these discs bend, and the ligament allows that bending. It will bend along with the spine. This ligament turns to bone. You can say it calcifies, it hardens up, and that's what you saw in that the slide before this one, the calcification or bony growth of this ligament. And I'm not exactly sure. I think it turns this ligamentic bone, and maybe there's some extra growth over the top of the ligament. So let's take a look again at the picture. So that ligament is right here on the spine, and it turns to this bony candle wax flowing like hard material, which wreaks havoc on spine flexibility, causes pain, can fracture, cause real problems there. All right, now I'm going to show you a schematic of the spine and where my doctor thought that bony growth is occurring on my spine. But Dish is so little understood, and in fact, most joint problems are not very well understood. And so it's tough to differentiate. Do you have Dish? Do you have bone spurs? Do you have something else when you got pain in the back and the spine? So I've got several things going on. One of them is Dish. One of them is what's called a bone spur. And that's a growth on the ends. This is a normal spine. You can see you've got discs in between the vertebrae. You'll get growths on the end of the vertebrae that look like this, and these are bone spurs. And I've got them, and a lot of Dish patients have them, and they interfere with movement and they cause pain. And so it's tough to differentiate. Is it the bone spur that's causing your problem, or is it that calcification that's causing the problem? In my case, I've been diagnosed with both. So let's look at my issue. I brought this schematic of the spine. This is not my spine. It's just a general picture of the spine. This is looking in from the back. I brought this to my rheumatologist, and I said, all right, tell me what part of my spine is fused. I wanted to see how bad my back was. So he annotated certain sections of the spine and commented on what he was seeing in the X-ray and the CT for this stuff. And if you look at this, let me enlarge it here. Okay, let's go down from the neck. All right, so this is the neck part of the spine, the cervical spine. The doctor wrote big spurs on this. So he didn't see the candle wax flowing, the total fusion of the vertebrae, but he did see big spurs. And I'll tell you, my neck is always sore and stiff, and it can rotate maybe 15 degrees in either direction without stiffness and pain. So there's something bad going on there. I think it's the spurs. When you get down more into the thoracic region of my spine, he marked off the top some. Let's get that, yeah. So the top several vertebrae mostly fused. That means there's not a continuous flow, but there maybe two are fused, and then there's an opening, two more fused. And here's the real problem. When you get down to the thoracic spine in the middle of the body, I've got a continuous fusion basically for this spine right down to that one. And the good news, if you can call it that, is in my lumbar spine region, which is the lower back region. Again, I've got spurs in this region, and I do have some lower back pain. It's not terrible, but at least I don't have total fusion in the lumbar region. So that's, for me, this was depressing, especially because of the big region that was fused here, but it gave me an idea of how bad my dish is, or how good it is. And I guess the rheumatologist called it a moderate case of dish. All right, so let's get back to 100%. I want to talk about x-rays here, and some people say, you're going into too much detail. Well, your doctor is going to be showing you x-rays, and it's hard to interpret these x-rays. I worked at the Mayo Clinic for a while in the biomechanics lab, and I used to attend presentations by the physicians, and they'd throw x-rays up on the screen of not only the bones but tissue and say, and look at this region here and how abnormal it looks, and I couldn't make head or tail of the x-rays. So it's somewhat helpful because your doctor is probably going to show you x-rays if you do have dish or anything similar and try to explain what's happening here. So this is a normal spine x-ray. The vertebrae are looking pretty square and blocky. Good disc separation. You can see in this anterior or frontal part of the spine where mine is fused, you don't see bridges across those openings. So that's a normal spine. That's what you want your spine to look like. And here's the problem. This is a spine with the front of the spine is here on all these x-rays. I got 3 different x-rays. One's of dish, one's of AS, ankylosing spondylosis, and one's of just a degenerative spine. And any of these can cause the problems that you might see with dish and back stiffness and pain and all of that. So it's kind of good to understand what the difference is. So in dish, you can see this white region at the front of the spine. This is where you're getting fusion, solidification, bone growth, calcification, growth between the vertebrae of the spine. This is AS, where AS has very similar symptoms, and it's kind of hard to figure out a differentiation between the two diseases. There are certain things they look for, which I won't go into in detail, but my doctor looked for those things, and he thought I had dish instead of AS. But again, you can see that white line down the front of the spine showing that that region has fused. But notice the discs are of reasonable size here. When you get into degenerative spinal issues, you got a lot of bone spurs growing on the front here. The discs are compressed and they don't function as they should. The spine has just deteriorated enough that it causes real problems. And let's look at these 3 x-rays in more detail. Okay, this is the dish. You can see that white, and notice it's kind of a rough band, and it's not continuous down here, and it looks pretty good up here actually. Here's AS. It's not as rough, but it's continuous band of fusion, and this is degeneracy, and here you can see the discs are virtually not there in a lot of cases. So I thought I'd show a hard to interpret x-ray because I've seen a lot of these for the conditions where my doctor is trying to show me what's going on, and it's been very difficult for me to see this. So this is a normal, not a normal, this is a dish, person with dish. I call it a hard to interpret x-ray, but it gives you an idea of what you might run up against when you're looking at your doctor's x-rays. Back of the spine here, anterior or frontal part of the spine here. You can sort of see bone spurs and a little bit of fusion. You can see, but very difficult. It's a lighter portion of the spine. I'll show you a close-up of this next, and you can see it better. But you're looking at this, and this is, I think, why a lot of doctors have trouble diagnosing this. Hard to see the effect. So here's a close-up of that spine, and here you can better see there's some junk here in the front of the spine, and it looks like it's fusing all these spinal cords together. So what are the issues moving forward? Well, can anything be done about my spine? Would physical therapy or chiropractic help? I don't know because I haven't tried them yet. I do keep relatively active and I think that helps, but I'm not sure that activity does anything to bone bridges. I'm not on any kind of medication because I believe I have a mild case of DISH, but the stiffness and the pain, especially my chest pain, is getting worse, and I'm thinking more seriously about taking some kind of regular pain medicine. I don't know. I hate pills. I don't like any kind of medicine or pills or drugs or anything else. So I've avoided it up until now, and it's acceptable. Surgery. I don't see any common types of surgery available for bone bridges on the spine. There is some surgery for bone spurs, and I'm not sure what they do there. They may grind them down or cut them off or something. But the bridges between the vertebrae, it doesn't seem like they do anything to those. And I think a lot of that is that the anterior longitudinal ligament is converted into calcium or bone, and therefore if they try to cut that out, they would damage that ligament, which kind of holds your spine together, so that would not be good. So what does the future hold? Well, DISH is a progressive disease, which means it gets worse over time. I don't know how mine is progressing, and I don't think any of the doctors can tell you how fast it will progress. I've never seen a case where somebody with DISH has actually improved. In other words, those bone bridges have either been reduced in size or disappeared. I've toyed with the idea of maybe having x-rays taken every year to track the progression of the disease, but nobody seems to recommend that either. So we'll just have to wait and see what happens with this disease. I wish you luck and hope you are well.